It's a great pleasure to introduce some old friends and make some new ones. Um, we have a wonderful panel to talk about issues of accountability and lessons, including Senator Collins, Dr. Dzau, Jeremy Farrar, and Sylvia Matthews Burwell. I want to start off with introducing Senator Collins, whom I remember from the 9/11 Commission work years ago, when I was a lot younger, but she looked exactly the same as she does now. For folks who don't know Senator Collins is one of those people who actually get things done in the United States Senate. And when it came to the aftermath of 9/11, she was a key mover in creating the commission, but maybe even more importantly, she was a key mover in enacting the legislation that turned the commission's work into constructive results. She and her staff were one of, I think, the 2 or 3 key legislators and teams that actually got the legislation done. And it was impressive to watch her in action. So and by the way, she's the person who, with Bob Menendez, dropped the leading bill in the Senate last year to think about the idea of recreating a 9/11 commission for the COVID case. So she's a perfect person to lead off our panel now. Senator Collins?
Thank you very much, Philip. I remember very well our working together to translate the recommendations from the 9/11 Commission into legislation. It was extremely difficult, but ultimately we prevailed 5 months after the commission issued its report, which by legislative time is very rapid. And we did pass the most sweeping changes in our intelligence community since World War II. And although not perfect, I think those changes have kept our country safer. As you know, there are definite parallels between the 9/11 Commission and what I believe we should do to ensure that our response to future pandemics is more effective, that we look at what we did right, what we did wrong, and what we can do better. And we should keep in mind that this is never going to be easy. And I'll comment on that when I talk in just a moment about some of the hearings that we held. With the model from the 9/11 Commission in mind, as you mentioned, I did team up with Senator Menendez last year to introduce a bill to create an independent, nonpartisan commission to assess our nation's preparedness and response to the COVID pandemic and to provide recommendations to improve our readiness when we get the inevitable time in the future when another pandemic strikes our country. The National Coronavirus Commission Act would establish a 10-member independent body appointed by President and congressional leaders comprised of prominent Americans with expertise in a wide variety of fields. Similar to the 9/11 Commission, it would have a broad mandate to compile a full and complete accounting of our nation's preparedness and response, and to craft recommendations for Congress to consider. I'm particularly mindful, as you are, Phil, that now is a time when our nation needs to come together in a factual, bipartisan, indeed nonpartisan way to review our response, what happened, what went wrong, what went right, and to come up with potential solutions for Congress and other policymakers to implement. This review is going to have to go to great lengths to avoid politicization or partisanship, but I believe, and I know there are different opinions on this, that it's essential that Congress be involved in appointing the members and the president, our new president, be involved, because we need to have some ownership in this in order for us to accept the recommendations. One key focus for our commission would be our over-reliance on foreign manufacturing for prescription drugs and other critical materials, such as personal protective equipment, known better as PPE. Approximately 72% of our manufacturing facilities for active pharmaceutical ingredients supplying our American market are located overseas, including 13% in China and 18% in India. Well, what happened when the pandemic struck India? India immediately imposed an export ban on 26 APIs. And we know that China hoarded PPEs that our country desperately needed. The CARES Act, which was enacted in March of last year, did include some components of legislation that I authored that gave the FDA greater visibility into the location where critical materials are manufactured and requires manufacturers to maintain redundancy plans for essential manufacturing. I worked very closely with FDA Commissioner Hahn and participated in excellent hearings before the Senate Health, Education, Labor, and Pensions Committee, but clearly much more needs to be done. The CARES Act also directs the National Academy of Sciences to report on the security of America's medical product supply chain. And Dr. Dzau, I look forward to receiving the recommendations when your work is completed. A commission should provide direction and legislative recommendations as we work to rebuild a much stronger capability that includes increased domestic production of vital prescription drugs and medical supplies. And also, we need to better understand how we can surge medical personnel. I am, however, humbled by two further points about congressional oversight. In going back and looking at the hearings, I noted that in June 2008, that Senator Lieberman and I chaired a hearing on the medical surge capacity of local, state, and federal personnel. And we uncovered serious gaps in our nation's capacity to provide mass care in a coordinated manner should thousands fall ill as the result of either a terrorist attack or a pandemic. We were looking at the pandemic flu at that point. In November 2009, we held another oversight hearing on the H1N1 flu, and it was entitled Getting the Vaccine to Where It Is Most Needed. Yet we know that problems have persisted. Obviously, congressional action and oversight are critical. That's one reason why I think we need the commission and we're going to need legislative reforms. We have a long history of uniting during crises. I think it's been challenged right now, but I hope that and know that we can do so once again. And I think a commission is absolutely essential. Thanks so much.
So I'm going to ask now both for Victor Dzau and Jeremy Farrar to come on, because both of them are close to current international efforts to examine accountability here. Victor, through his role at the National Academy of Medicine, and Jeremy Farrar looks after the Wellcome Trust, which is one of the key sponsors of work on public health around the world. And they have unique insight into the efforts that are being done transnationally to reckon with this disease. So Victor and Jeremy, take it away.
Thank you very much, Phil, for including me. And Senator Collins, it's great to see you again. And Secretary Burwell again. And of course, my good friend, Jeremy Farrar. So as you mentioned, there are independent studies now being carried out. One which is best known is the Independent Panel on Preparedness and Response. run by Helen Clark and Ellen Sirleaf. And this one is going to look at the global overall response. And I do think one of the questions we need to ask in our commission is how much, since we're globally connected, how much of the work in the global context is necessary, which I believe it is. There are a number of other studies like the Lancet Commission, which is done mainly through as a private sector, the former being for WHO. And then Jeremy and I are working on a deep look at sustainable financing for preparedness, prevention, and response. This is work that's being carried out now in concert, at least in the making with G20. So there are many different issues globally. If I may, I think for me, this commission needs to look at some of the important issues, aside from my early remarks about a national strategy, coordination, but what is the role of CDC, which has been probably arguably the most shining light of public health in the world. And, you know, are we underinvesting? How much more autonomy does we need to give it? We do need to look at hospital preparedness in terms of capacity and workforce. Certainly to me, the federal and state issue remains to be a very important one, as I said in my remarks, and that all of this has to be all of societal approach, as been pointed out, the issue of social protection, not just health protection, the issue of equity in round population, and of course, as I mentioned, the global landscape is important. I'm happy to say a few more words about global landscape, but why don't I let Jeremy speak first? And then, if you wish, tell you what I'm thinking or what are the issues of the global evaluation. Thank you.
Thanks, Victor. It's great to see you again. And that bookcase behind you, I seem to have seen so many times over the last few weeks and months. And it's a great pleasure. It's a great pleasure to be invited to join the Futures Forum. And thank you very, very much indeed. I'll hand over to Victor in a second, but I think it is important as we think about commissions, and Victor and I are we hope driving a look at the sustainable future financing and governance of these issues at a global level. Because whilst I appreciate that every country is having to look at itself and look after its own citizens, it is also crucial at this juncture as we come, I hope, through this crisis, that having flirted with nationalism over the last few years, and I only speak of my own country, the UK, where that has undoubtedly been true, and whether or not it's true in other countries, you can judge. But we flirted with nationalism over the last few years, with populism. And I think we need to appreciate that the drivers of this pandemic have been drivers which will not be unique to this pandemic. They are about the changing ecology. They are about the way humans and animals interact. They are about urbanization. They are about trade and travel. And they are also about geopolitics. I don't think it's unrelated, the fact that this pandemic has caused such devastation at a time when politics was so polarized globally. And the willingness amongst some to work together across borders has, at least to some degree, I believe, hampered the global response. The either unwitting or the deliberate undermining of national and international institutions over the last few years, I think, has been very damaging. Both within countries and between countries. And I think unless we, in the commissions that will inevitably follow, unless we look at all of the drivers of it, which won't just be drivers of pandemics, they'll also be drivers of climate change. They'll also be drivers of access to clean water and energy. They'll also be drivers to addressing issues of inequality in all of our societies. Unless we look at all of those, re-look at the ability to balance resilience and efficiency, the ability to provide for all of our citizens, not just for a small percentage of them, I think we will see further challenges like this. The other, I think, is that whilst commissions must learn the lessons of this epidemic as it's reverberated around the world, we mustn't only prepare for this sort of situation. We have to have sufficient resilience in the system. We have to have sufficient surge capacity in the system that we're able to both respond to what we know about and what we don't know about, and how across governments those are integrated. There is no point having within governments, whether federal, state, or in unified governance structures, to have silos of health, economics, business sectors, private sector, public sector, to have all of these siloed if they cannot then work together in a crisis. The only way to work together in a crisis is to have worked together in the intervening times and to have built up those relationships, institutional structures, and ability to work across as well as within the silos that we're all part of. And finally, a comment on, whilst there will be many commissions and reviews and reports about the public health systems, unless ultimately we have sustainable investment and financing, and in particular investment in people, then we won't be able to have the surge capacity we need when we need it. You only have that if you invest in it when you do not need it, and it'll be there when you do need it. And that investment in public institutions, I think, is absolutely crucial in the years to come. So hand back to my good friend who we spent a little too much time with over the last few weeks, Victor, to finish off our segment.
Victor, if I could interrupt, though, I know the sponsors feel that we're a little short on time, and I'd like to give Sylvia a chance to address these issues.
Thank you, Philip, and honored to join this group that I've had the opportunity to work with in many forms. And a couple of comments I would make as we think about how we evaluate and be better prepared for a next round of whether it is this pandemic or, as Jeremy just said, I think it's extremely important to think about preparation, not for just this specific incident, but for other things. One thing as we think about accountability is I think it's important that we all start to think about what are the measures, what would success look like? Are we talking about mortality, morbidity, speed? And so as one thinks about evaluating what happened, understanding what are the core measures that you measure whether or not you are successful or not. And I think that's a very important thing, especially right now as we're in a place in the pandemic where the question of how people think about 4,000 deaths in a given day in the United States, is that a measure? And if it's not, why not? But how we think about it. Another element as we think about commissions and the ways to review what has happened and how to be better prepared is, I think, realizing that in this type of situation, a pandemic and some of the others that Jeremy and Victor both mentioned, one has to think about that it occurs and the response to it occurs at the international level, at the national level, at the state level, at the local level, and the individual level. And that is different than certain other types of crises. Every individual in every country has a role to play because basic public health that's occurring in your town, in your community, in your neighborhood, wearing masks, being distanced. It's an important part of that trajectory as you think about the questions of accountability, that accountability has to be from the individual citizen, which gets to some of Jeremy's points that he was making about why we have to think about these things broadly, to the international community and how we work together there. So I think that's another important part of the framing. And that leads to the importance as one thinks about a commission and an evaluation of execution and integration. We know that preparedness is extremely important, but I think what we will find and we need to examine deeply is the importance of the role of execution and integration. And as we think about that role of execution in governments, what are the main functions as we examine and look for being better prepared? And I would posit there are some very important roles, and one of those is tools, and that gets to some of the things that the senator was talking about and how we legislate to be able to have the tools at hand, whether that's the tools that a hospital needs or the tools that a state needs or the tools that a local public health community health center needs to put vaccines in an arm. Do we have the tools? And the other that I think we need to think through is communication and the importance of communication in a time of great uncertainty and evolution and changing, and where everyone from an individual citizen to international governments coming together are important.
Well, we've got about 5 minutes left. And Sylvia, I know you co-chaired a Council on Foreign Relations task force that has already begun to try to think about the international side of this. And I know Victor wanted to comment a little bit more on the international side too. So talk a little bit about how we do transnational learning in a case like this, where we're clearly dealing with a transnational problem.
I'll make one point and then turn to Victor. There were a number of points in our report, but one that I think is particularly important is how we figure out how to do surveillance appropriately and move that information. We know that the movement of information well and quickly was something that could make a difference in the response. And so I'll just mention surveillance and then turn to Victor, who I think had some more points.
Very kind of you. My main point is that we recognize this is a pandemic. As I said earlier, an outbreak anywhere is outbreak everywhere. So I think we do need to look at our role as US in terms of a global context. What Jeremy is saying, and he and I have been working on a number of initiatives, we realize that those initiatives, such as sustainable financing, governance, cannot really be effectively take place without the presence of the US. So the question really is how to bring US, I think this commission should take a look at this, because I would say you could argue that we got the vaccine that we want, and every citizen will have it. But if you don't stop it elsewhere, this is still going to be a great threat everywhere. So what's our role in the international arena? I believe we need to take a really major leadership role. And I do think that last few years that role has been diminished. And everybody's looking forward to having US back at the table again.
Jeremy, Senator Collins, do you want to pitch in on this?
Clearly, and I remember a conversation that I had with Bill Gates about this, in this world of global travel, if we do not help other countries that need our assistance gain control of a pandemic, it's going to make the situation worse in the United States. It was, however, troubling to read one study that suggested that some of the countries that had had the best success were the most authoritarian, which is not a style that's going to go over well in the United States. I have huge admiration for Secretary Burwell, and we've worked together on issues. When she used the word surveillance, instantly my antenna went up, because I know she's talking about contact tracing and that sort of activity, but it's a point about why we need to be careful about our language and about how a point that she earlier made, with which I totally agree, about the importance of communication, because surveillance by the government in our country conjures up very anti-American behavior. And when I learned that China is credited with doing one of the best jobs of controlling the pandemic, which I will say, I'm not sure I believe, because China doesn't necessarily tell the truth, that too is alarming. Somehow we need to rebuild a sense of community in this country where we realize that we are all in this together and that each of us has a personal responsibility, and those of us in government have a special responsibility to make sure that the tools, the funding, and the cooperation is there at all levels of government in the United States as well as internationally.
Can I just to point the question a little bit more at you, Jeremy? Are we actually doing a good job of cross-national learning?
Can I just say, as a non-American here, we're very much looking forward to having you back at the table. Yeah, I think there are cross-national lessons to be learned, but they've got to be the right lessons. I mean, the Senator did just talk about the authoritarian regime, but I could point to Norway has done an amazing job during this, New Zealand, even Australia. You know, these are not authoritarian regimes, and yet, of course, but they've done an amazing job at controlling. So I think there are all sorts of ways you can control this. I just pick up on Sylvia's point of view, perspective there on implementation. It's so important in this country, the UK, when we tried to pull the levers to stop the pandemic, we just found we were not able to execute. And the ability to execute goes beyond the ability to talk in warm words. And that has got to be the heart of it, as well as the other comment Sylvia made around communication and trust. You find all over the world, those governments that are trusted or not trusted have had a major difference in the outcome of this pandemic. Trust and communication is at the heart of, and honesty is at the heart of good governance. And that's one of the things for me that's come out of this pandemic.
And that is a perfect summary of the theme of this whole panel on how to obtain accountability. So thanks, Jeremy, for that wrap up. And thank you, Senator Collins, Sylvia, Victor, Jeremy, for joining us on this.
Thank you. And my thanks
Pleasure.
to my fellow panelists too. And to you, Philip.
Thank you as well. Thank you.
Thank you.